Hello, my name is Dr. Thomas Lamperti. I'm a double board certified facial plastic and reconstructive surgeon in Seattle. I'm here today to talk a little bit about the two approaches available for rhinoplasty or nose job surgery. The two approaches are basically that of an internal or external approach. Other names for this are endonasal for the internal approach, or open rhinoplasty for the open approach or external approach. The main difference between the two approaches is that of where the incisions are placed. For an endonasal or internal rhinoplasty, the incisions are all placed inside of the nose and inside the nostril, so that there's no external scar. For an open or external rhinoplasty, the incisions are very similar, except that there's one additional incision right along what's called the columella, that little bit of tissue between the two nostrils. And so there's a little jagged line scar in that area that allows us to lift the skin up on the tip of the nose, sort of like lifting the hood on a car is how I equate it, and gives us a little bit more open approach. That's the other term that's used for it, is an open approach. There's no right or wrong method necessarily for doing rhinoplasty, and in my hands, both approaches have their use. The open approach or external approach is more commonly used in my experience and for the patients that I'm treating, in that I'm able to get a more open or wide view and be able to affect the changes that I'm needing to. The more things that you're needing to change, often the more access that you need in order to make sure everything is symmetric and structurally stable as possible. Certainly, depending on the changes that we're shooting for, an internal approach with just smaller incisions on the inside is certainly feasible. There's numerous patients on my website that have had just an internal approach or an endonasal approach. I don't want to sacrifice the ultimate results functionally to do an internal approach where in 5 years or so perhaps there'll be pinching or scarring that'll result as a process of not being able to maintain that support that I want. But I would definitely give you the options available and lead you through the thought processes with why I would suggest one approach versus the other.